Hi, I want to talk to you about apologizing the right way. And there is a right way and a wrong way. One, I'm just asking you to apologize if you've done something wrong. If you haven't done something wrong, you don't have to take ownership of that. You can acknowledge that you understand somebody's upset and feel empathy for their frustration. Those are good things to do as well. But I'm not asking you to take ownership of something that you didn't actually do. But in the instance that you did make a mistake or you did cause some sort of duress with a patient or their family, we should all know how to apologize the right way. And the first thing is to take ownership, to say, I take complete responsibility. I am sorry. So if you didn't update a patient with how far the doctor was running behind and they become agitated, you can say to them, I apologize. I didn't update you the way I should have, or I didn't get back with you to explain to you what was happening. Own that. There's nothing wrong with that. People are much more receptive to ownership than to ignore that. An apology face-to-face is the most important way to apologize, but sometimes I know we cannot do that, and we may have to do it over the telephone, preferable, if it's not face-to-face, or through an email. But like I said, I would always encourage you to apologize face-to-face first. The purpose of an apology is to be sincere and genuine and really be empathetic to the problem that was caused, and in your ownership, just to really genuinely say you're sorry. You're trying to make this relationship right again. That's the whole purpose of an apology. And the first way you can do that is listen to them. Listen to what they are saying and why they're upset. Use good positive body language. Sit if you can. Give them your full attention. Don't get in your defensive stance or shake your head or furrow the brow, but really listen to why they're upset. You can always find empathy in that. And then please, when you're owning this, don't cast the blame on somebody else. Don't say, well, so-and-so should have done this, or the back office. If we're going back to that patient that's very upset in your lobby or in the ED because nobody has seen them, if you didn't update them as to why, then own that. But don't say, well, the nurses in the back didn't tell me that the emergency room physician was running behind. Just apologize. Just own that, and not to cast blame. And then you can, show empathy, but also you can be defensive in your apology, and people sense that immediately. They know when an apology is genuine and when it's not. And so if you say, oh, I'm sorry you feel that way, they know you're not really sorry. But you can say, I take ownership. I should have updated you. I should have given you more information, and for that, I'm apologizing. And then tell them what you're going to do to fix it. Then you can say, I'm going to go right now, and I'm going to figure out, as close as I can to when the doctor will be able to see you. Or I'm going to go talk to my supervisor and figure out how we can remedy this situation. Or thank you for sharing this with me. I know it doesn't help you, but it helps me not make this mistake again in the future. These are all ways we can apologize and repair relationships with patients. And I promise, never be afraid to say you're sorry. Saying you're sorry when somebody deserves that apology shows great strength and compassion. So, hope this helps. Hope you can use some of these tools.